Hello guys, good afternoon to all of you. So today we are going to talk about pharyngeal arch 1. Okay, so there are 5 pairs of pharyngeal arches. Okay, 1, 2, 3, 4 and 6. The fifth one is rudimentary or absent, which means it either regresses quickly or it doesn't form. Okay, so in this session we will be talking about the first pharyngeal arch. Okay, so the first pharyngeal arch, if you see, basically, before moving into pharyngeal arches, I would like to tell you what is a pharyngeal arch. Pharyngeal arch is basically a small bulge which is present in the neck side of an embryo. So what does a pharyngeal arch do? A pharyngeal arch is the building block of the head, neck, ears, throat, whatever the head and neck region. Okay. So the pharyngeal arch is very important because any malformations can lead to a few syndromes which I'll be talking in the later aspect. Okay, so pharyngeal arches are small bulges that is present in the head and neck of an embryo, which is the building block of the head, neck, throat and the ears. So whatever structures you see, be it nerve, artery, muscles, ligaments, bones, whatever is developed from the pharyngeal arches. So today I'm going to talk about pharyngeal arch 1. Okay, so first thing what I'll be talking is the nerve supply. So the nerve supply to the pharyngeal arch 1, it's going to be mandibular nerve. So mandibular nerve is a branch of trigeminal nerve, which is the fifth cranial nerve. Okay, so the trigeminal nerve has V1, V2 and V3. So mandibular nerve is V3. Okay, V1 is ophthalmic, V2 is maxillary, V3 is mandibular. So mandibular nerve is the only branch of the trigeminal which has a motor component. What is a motor and a sensory component? Motor is muscles, basically movement of muscles. So the brain signals the muscles to move. So the signals move from the brain to the periphery. What is sensory? Feelings, touch, pain, temperature. So it is taken, the information is taken from the periphery to the brain. Okay, so when I talk about motor, I'm going to talk about muscles. When I talk about sensory, I'm going to talk about the touch, pain, pressure, temperature, all those things. Okay, so the mandibular nerve is the nerve of pharyngeal arch. What does a mandibular nerve do? It has a motor component and a sensory component. So the motor component supplies the muscles of mastication. What are the muscles of mastication? Temporalis, masseter, medial pterygoid and lateral pterygoids. And then it is going to supply anterior belly of digastric. Anterior belly of digastric, it basically helps to elevate the hyoid bone and depresses the mandible. So when I depress the mandible, I'm going to open the mouth. Okay, and then it is going to supply tensor tympani and tensor veli palatini. What is the function of these muscles? These muscles are basically going to reduce the vibrations and also it equalizes the pressure. Okay, apart from this is also supplied mylohyoid muscle. Okay, so the muscle component of the pharyngeal arches are basically supplied by the mandibular nerve, which is the V3 division of the trigeminal nerve. What is the trigeminal nerve? It is a fifth cranial nerve. Simple, right? Okay, now moving on to the artery. So artery, if you see, the artery of the first arch will be maxillary artery. So maxillary artery, if you see, it is one of the terminal branches of external carotid artery. Okay, next will be cartilage. What is a cartilage? Cartilage is basically, it is a piece of tissue which is flexible, okay, and it acts like a cushion. So basically cartilage, if you see, it is forms under the end of the joint. It protects the end of the joint. It acts as a shock absorber. It also gives shape to the body parts. Like you see the flexible part of the ear, the bendable part of the nose, the tip of the nose, this part of the ear, all these are cartilages. So cartilage basically gives shape to the part and also it forms the end of the joints. It acts as a shock absorber. Okay, so cartilage can give rise to a bone, can give rise to ligament, it can remain as a cartilage as such. So it can transform into anything, or it can remain as a cartilage as such. Okay, so cartilage of the first arch, it basically Meckel's cartilage. So basically this is going to give rise to incus, malleus, and also it gives rise to a ligament called sphenomandibular ligament. Okay, what is a ligament? Ligament is basically a stretchable, a band of tissue which is kind of an hard, and it protects the bone, it forms over the bone, it protects the bone and helps to control their movements. Okay, so the bone is covered by a ligament which helps to protect the bone, and also it limits the movement of the bone. Okay, so cartilage, Meckel's cartilage, which gives rise to incus, malleus, sphenomandibular ligament, and also it helps in the formation of some bones like maxilla. Okay, and the mandible is also formed in pharyngeal arch 1, but it is not because of the cartilage, it is because of the membranous ossification. Okay, so cartilage is a piece of tissue, soft piece of tissue like a sponge, which acts as a cushion effect. It forms in the end of the joint, so it gives shape to the bone and also acts as a cushion, shock absorber. So cartilage can give rise to bone, ligament, sometimes it remains as a cartilage. So what is the cartilage of the first arch? Meckel's cartilage gives rise to incus, malleus, sphenomandibular ligament, and other bones will be maxilla, and mandible is not formed by the cartilage as such because it is formed by the membranous ossification. Okay, now nerves, artery, cartilage, and also some kind of